Welcome back to East Texas Live on KETK, and May is Stroke Month. And here with us this morning is Mari-Carmen Kennedy. She is the Stroke Program Coordinator with the CHRISTUS Trinity Mother Frances Health System. Good morning.
Good morning. Thanks for having me.
No problem. What is Stroke Month?
So it's just a time that we take to spend a little bit of time to inform the community a little bit more. Stroke is such a burden to our community and the surrounding areas that we want to just make sure that we take the time to educate and inform.
So how common are strokes?
They are actually very common. They're the 5th leading cause of death and the #1 cause of disability in the United States.
That is terrifying. So what is it? What causes stroke? Like, what are the risk factors?
Well, things like high blood pressure, diabetes, high cholesterol, smoking, irregular heartbeat called AFib, a sedentary lifestyle, these can cause stroke.
And who is most at risk for having a stroke?
I think anybody that has those risks put themselves at a risk. If you add another risk, then you're adding more risk to the possibility that you'd have a stroke. But these are all, most of the people that have strokes do have some risk factors that we can work to correct. That, you know, age, race does play a factor. You can't change those things. But you can change your lifestyle and make things less risky for you.
So what happens during a stroke? Like, what happens to your body?
So a blood clot goes from one portion of your body into your brain and blocks an area of the brain, and causing that area to essentially die. We have, at CHRISTUS Mother Frances, we have some great treatments. We're the first comprehensive stroke center in East Texas, Northeast Texas. And so we're able to give clot-busting medications. We can go in and retrieve the clot and restore blood flow to that area of the brain. Some really innovative procedures and techniques that we can use.
And about those procedures, how does that separate y'all maybe from other healthcare systems in our area?
There is no other healthcare in that area, in our area. The closest ones would be Dallas or Houston Memorial Hermann. Big facilities like that, we can keep you close to home and give you the care that you need and still have the family around. That really increases your wellness.
How do you know, is there any way of knowing that you have a stroke coming on?
Absolutely. We like to teach the acronym FAST. It stands for face, arm, speech, and time. If you have facial droop, if one of your arms is weaker than the other, if you're having trouble speaking or understanding the spoken word, then it's time to call 911. It's a true emergency. Like chest pain hurts. Strokes don't hurt, but they cause so much damage in the body. So it's not something to play around with. It's time to go to the hospital by ambulance. And
if people wanted more information on strokes, do y'all have a place where they can look?
We do. We keep our CHRISTUS Trinity Mother Frances website updated. It's tmfhc.org/stroke.
All righty. Thank you very much.
Okay, thank you.
Well, up next.